Hi, and welcome to Pharmacology of the Synapse. In this video, we will explore the negative effects of cannabinoid use and their abuse potential. In general, there is a conception that marijuana is safer than other drugs of abuse. Is this true? Just how much do we know about the negative effects of cannabis? Annual deaths due to different causes show that there are few, if any, deaths by marijuana overdose, whereas tobacco, poor diet, and alcohol are the top causes of death in the Western world. Statistical surveys indicate that people are more willing to take marijuana than any other illegal substance, and this may partly be driven by the fact that there is a lack of overdose deaths. In the 2017 National Academies of Science, Engineering, and Medicine report, they found enough evidence in the research to support the following negative consequences of cannabis use. Respiratory diseases, which are more likely due to the act of smoking marijuana rather than the effects of cannabinoids. Increased risk of car crashes and lower birth weight for babies. There was no evidence for an association with lung, head, or neck cancer, which is in contrast to something like tobacco smoking. The report also found associations between cannabis use and the development of schizophrenia and other psychoses, with the highest risk amongst the most frequent users. The report stresses that the causal relationship is unclear and is likely due to complex gene-by-environment interactions. Other consequences of note are increased suicidal ideation in the heaviest users, exacerbation of bipolar symptoms, acute impairment of learning, memory, and attention. Adolescent use of cannabis has been associated with impaired academic achievement, education, reduced employment, income, social relationships, and roles. In addition, there is evidence that cannabis use is associated with increased likelihood of developing problem cannabis use, which is one definition of cannabis addiction. The 2017 report focused on cannabis and medicinal cannabinoids. Synthetic cannabinoids are structurally distinct compounds that are very potent full agonists of the CB1 and CB2 receptors. They are often sold labeled not for human consumption under a variety of names. The high potency and full agonism contribute to the likelihood that these drugs cause acute, severe cannabinoid toxicity or overdose effects. These can include psychotic symptoms, hyperemesis or continual vomiting, hyperthermia, and seizures. There is very little research on this class of cannabinoid drugs.